Hello and welcome. My name is Gita. In this series of pre- and postnatal exercises, we're going to cover a few important points for exercising safely and effectively during pregnancy and postpartum. I would like to start this series of exercises with a breathing exercise. Breathing is probably the most important part of all of these exercises that we're going to cover. And also breathing is something we do all day and all night, so it's super important. And all breathing is good. So we're going to talk about the most optimal way to breathe. However, all breathing is fine. Once we're breathing, we're good. For this exercise, we're going to use an elastic band, any elastic band, or alternatively, we're going to use a pair of tights. So stretchy tights or an elastic band. To begin with, I'd like us all to just notice how you're breathing. Either you're sitting down or standing, just notice how you're breathing. Take a minute and pause and notice how you're breathing. Where does your breath go? You can place your hand onto your chest and one onto your belly and just notice where your breath goes. Which part of your body raises and falls when you're breathing? Which part of your body rises and falls more significant than the other? So perhaps you could be as they call it, a chest breather, if your chest rises and falls the most. And when someone is a chest breather, breathing through your chest is fine. As I said earlier, all breathing is good. However, that can create a lot of tension in our shoulders. We do this motion of breathing with our shoulders when we use chest breathing. We can't really see it because the tension that's created here kind of becomes permanent. But very often, if you are a chest breather, if you notice that you're breathing into your hand on your chest, you probably have quite a lot of tension in your shoulders and your neck. So that's one kind of breathing. If you notice that you're breathing into your belly most, that your belly is expanding and falling, more significant than your chest, you probably maybe are as they call it, belly breather, which is also fine. It's breathing, and that's what we want to keep doing. However, it's not the most optimal position because it creates quite a lot of intra-abdominal pressure, and that's not very it's not the best way to breathe for many reasons, and one of the most important one while you're pregnant and newly postpartum is that intra-abdominal pressure creates quite a lot of extra load for your pelvic floor, and you already have a huge load onto your pelvic floor with a baby inside you, or when you're newly postpartum as well, you're healing and recovering, and also carrying your baby so much of the day. So belly breathing is not great. It's okay, but it's not the most optimal way to breathe. So the third way to breathe is called diaphragmatic breathing. And that's what we're going to learn today. We're going to learn diaphragmatic breathing, and we're going to use now our pair of tights. We're going to wrap the tights around your rib cage. So where the area where the tights will go is the area where your bra strap would go or heart rate monitor would go. If you're explaining, if you're going to teach someone you know, which is fantastic. The best way to learn by newest research is to teach someone else. So if you're teaching someone else, tell them to wrap the pair of tights or a strap or a scarf around their ribs where your bra strap or heart rate monitor would go. And now what we're going to do is we're going to breathe in to the area where the tights are. So we're going to breathe into the area where the pair of tights are wrapped around us. And we're going to notice Please don't wrap the tights as tight as you, so that it's hard to breathe. Just that you feel the sensation as you're breathing. So try to breathe into the area where the pair of tights are around you. You can try and breathe this way while sitting down. It's probably the easiest way to realize what's going on in your body, or you can also practice standing or laying down. So breathing in and noticing how the area in your back is expanding. Let's breathe into our back. And exhaling the air fully. You can imagine you're blowing the candles on the birthday cake. Blowing out the air fully out of your lungs. So there's no drop of old air left in your lungs. Let's breathe into your sides now. And breathing out fully, fully, fully out. No air left in your lungs. Let's breathe out to the front now, where the pair of tights are wrapped around us. Breathing in and breathing out fully. One last time, let's breathe into your back, the sides, and the front. One second time. Okay, well done. So this kind of breathing also engages your core muscles, your transversus abdominis muscles quite well as well. And that protects your lower back, your lumbar spine. It protects, as I mentioned before, your upper back. It protects your neck. It reduces tension in the shoulder area and the upper back area. It reduces pressure on your pelvic floor. And in general, you're taking the most optimal amount of oxygen while using diaphragmatic breathing. And oxygen is so fantastic for general health, wellness, your physical and emotional health, and to reduce inflammation. And also, I haven't mentioned a really, really important part. Diaphragmatic breathing involves the muscles in between your ribs, which are called intercostal muscles, to work. So it's kind of internal weight training. When you're using diaphragmatic breathing, you're training your intercostal muscles in between your ribs to become stronger, and that strengthens your respiratory system, and then that strengthens your immune system. So there's so many beautiful, important points on diaphragmatic breathing. I recommend using this type of breathing a few minutes per day, maybe in the morning, in the evening, whenever you can maybe set that little bit of time for your self-care and practice your diaphragmatic breathing. And just before I finish the video, I'd like us all to put our hands around that same area where we had our tights, a pair of tights on. And let's breathe into our hands. Feel your hands raising and falling. Well, it's not your hands that are raising and falling, it's your rib cage and your diaphragm. But you feel the sensation against your hands. Feel the sensation in your back, in your sides and your front, and exhaling the air fully out. So remember, practicing makes progress. We're not looking for perfection, we're looking for progress. Practice makes progress. So we can practice together. You can ask questions or clarifications. And one last time before I log off, let's breathe into our diaphragm without the tight pair of tights and without the hands. Just remember where your hands and your pair of tights were. Let's breathe into that area. In and out. Again. In, expanding through your sides, back and front, and out. Well done, ladies. Thank you so much for watching. Thank you so much for practicing. And in the next video, we're going to talk about posture and actually how breathing and posture is so related. And we're going to learn some new interesting facts and practice some new exercises. And see you soon.